As the healthcare leader of the Tri-Parish community and with its Mary Bird Perkins Cancer Center at the forefront of cancer research and treatment, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community. All right, welcome back to Your Health with Terrebonne General Medical Center. I'm Martin Falls, and we're going to be talking with Dr. Robert Gamble tonight. Of course, he's a good friend of ours at HTV. He's been on HTV many times. He's a medical oncologist with Mary Bird Perkins Cancer Center at Terrebonne General Medical Center. And the United States Congress deemed January Cervical Health Awareness Month, and as part of a national movement to increase awareness and prevention of cervical cancer, TGMC is educating Louisiana women about cervical health. Dr. Gamble, welcome aboard. Good to see you.
Thank you very much. Thank you, sir. I'm glad to be here.
All right. Now, statistics that are related to cervical cancer. Can you give us a few of those?
Sure. About 13,000 women a year are diagnosed with cervix cancer. Usually it's found through a pap smear. Unfortunately, there's a small percentage of women who don't follow through with appropriate screening, in which case the disease is slightly more advanced.
Okay. Now, what would cause cervical cancer? A lot of known causes or what?
There are several risk factors. It's been known that cervix cancer is related to sexual activity, high-risk sexual activity, promiscuity, but also cigarette smoking, birth control pills, among other things, immunosuppression. The human papillomavirus, HPV, is a known oncogenic virus, which means it's a virus that is proven to cause cancer, in this case, cervix cancer. And it's a relatively common type of infection.
Well, who would get HPV?
Well, the HPV is the most common sexually transmitted virus, so sexual activity promotes its spread, and both men and women can catch the HPV. It's relatively prevalent in probably 75–80% of men and women in the country.
Okay. How about vaccinations for HPV? What are the vaccinations? Where have they come to with them? And can you elaborate on that a little bit for us?
Right. The research has shown that there are certain strains of HPV. There's over 100 different types. Approximately 40 are related to the mucosal area of the cervix and genital area. And of those, 13 to 15 are known cancer-causing viruses, subtypes. The most common to cause cancers of the genital area are types 16 and 18. They've also shown that types 6 and 11 cause genital warts, both in men and women. So there is a vaccine called Gardasil, which, when used appropriately, has been shown to decrease the incidence and chances of getting these HPV infections, which are, and again, the HPV, the Gardasil is directed against the types 6, 11, 16, and 18.
All right, we're going to take a break. We appreciate Dr. Gamble coming on. We're going to have some more questions for him, so we'll take a short break here from Terrebonne General Medical Center, and we'll be back more with Dr. Robert Gamble.
With the most comprehensive health care available, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
My husband and I have known each other since high school, and Bobby and I are very close. When I started losing my hair during my cancer treatment, he volunteered to shave his head too. My name is Sherry Starkey, and in 2007, I was treated for breast cancer at Mary Bird Perkins. 2 different doctors recommended Mary Bird Perkins, and everybody there was fantastic. And I know being close to home and family really helped a lot too. I'm still here, and Mary Bird Perkins had a lot to do with that.
Mary Bird Perkins Cancer Center at TGMC.
All right, welcome back to Your Health with Terrebonne General Medical Center. And our guest tonight, our good friend, Dr. Robert Gamble at Terrebonne General Medical Center. We're talking about cervical cancer awareness month. There's a good doc right there. And I'm sure you've seen him in and around the parish quite a bit. Let's get back to the topic, Doc, the symptoms of cervical cancer for people watching tonight. What are the symptoms?
It would depend on how extensive the disease is, but early stage, there surprisingly may be very few symptoms. When it does start, you may have a vaginal discharge that could be pale, somewhat pink, brown, and even bloody. There can be abnormal vaginal bleeding, which occurs in between the normal menstrual periods. There could be vaginal bleeding after sexual intercourse, and or any other type of abnormal vaginal bleeding. Those are some of the early signs. The later signs of cervix cancer may also be relatively nonspecific. Fatigue, feeling run down, tired. You may have some poorly defined pelvic pain, sometimes low back pain, sometimes leg pain. Sometimes you may have a swollen leg, one or two. But always in more advanced cases, you can have abnormal vaginal bleeding, and that's probably a key to something going on in the female pelvic area. Again, heavy vaginal bleeding would occur, like I said, between periods. There's a possibility of what's referred to as an enterovaginal fistula, whereby the woman may notice that she is passing urine or stool vaginally. And of course, that's a sign of a relatively advanced disease there.
Okay. For women watching, they all want to know how they can avoid cervical cancer. What do you tell them?
The best thing to do is something very simple, pap smear, which can be done by any of the TGMC OBGYN physicians. And concurrent with the pap smear, there's also an HPV test, whereby the sample that is obtained is sent for this viral evaluation. But it's usually started around age 30, and depending on the results of the pap smear and the HPV will determine how frequent, a yearly basis, every 3 years. Factors that also may influence how often would be the woman's health and a few other genetic changes. But usually it's starting with a simple pap smear, which is very easy to do, very simple, takes minimal time out of a person's daily activities, and potentially can save their life.
Now, who should get tested?
All women, obviously. As I said, starting at age 30. How often they should be tested is proportional to the results of the pap smear. And once again, the obstetricians at TGMC would be able to better tell the frequency of testing based on these results.
When someone develops abnormal cells, so to speak, can their body go into a repair mode?
Yes. Because HPV is so prevalent and the incidence of cervix cancer is so small, clearly the vast majority of people who have the HPV infection do not manifest any severe illness. Genital warts can happen in men and women who have the HPV because it can affect men and women. It is a sexually transmitted disease. But again, I cannot overemphasize the attainment of doing pap smears on a regular basis. As again, we mentioned, the body's ability to negate the effects of the HPV is very good. Our immune systems are very good. And most people who do get the HPV infections never know they have it. But again, we cannot risk stratified patients who get the HPV, we don't know who's going to go on to develop cancers or genital warts. And that's why it's very important for women to undergo pap smears.
Yeah, that's some great information. The treatment options, we always get the treatment options at the end of the question period. What are they? How are they available for cervical cancer? What would you recommend?
Treatment of cervix cancer is clearly dependent on what we refer to as stage, how advanced is the disease, characteristics of the tumor. Primarily, is it bulky, which means how big is the tumor, the general health of the woman, her heart, her lung, liver, kidney capacity, and whether or not she wishes to continue with childbirthing. The average age of cervix cancer in the United States is roughly 47, so that obviously means that it can affect not only premenopausal but also postmenopausal women. So treatment is, again, dependent on several of these features. For early stage disease, we can, the OBGYN physicians at Terrebonne commonly use local therapies, referred to as LEEP, L-E-E-P. They can use cryotherapy, which is freezing. They can also use laser therapy. The decision to use more advanced treatment, such as a hysterectomy, is again proportional to the characteristics of the tumor. For more advanced disease, bulky disease, then you bring in the bigger guns with radiation, chemotherapy, and always, if you can, try surgery.
How long you been doing this now, Doc?
Since 1987, is when I arrived here.
But I could always tell every time in the early shows we would interview you, your passion is remarkable.
Oh, thank
so
you.
We appreciate you coming by tonight and sharing this valuable information. So thank you,
Thank
Doc.
you very much.
All right, once again, Dr. Robert Gamble. We're going to take a break. When we come back, in the Canada's kitchen, Chef George Caslow, Tony DeSalvo, and our own Joni Petrie. We're going to see what they're stirring up, so don't go away. It's all next.